It was March 11, 2020. It seemed like a normal day with the distant threat of a new virus circling around the globe. Guyana was just settling into a protracted election period when the grim news struck. The country had confirmed its first COVID-19 case, a Guyanese woman traveling from the United States, who died. Now, 2 years later, there have been more than 63,000 COVID-19 cases and more than 1,200 deaths, with a 3-month-old baby among the youngest deaths. Despite the grim figures, there were glimmers of hope along the way. Vaccination, treatment drugs, and health workers who refused to give up. Now in March 2022, restrictions are being relaxed, and Guyana's Minister of Health, Dr. Frank Anthony, contends that COVID-19 now is a balancing act.
People really want to have some more freedoms. And so it's always a challenge. How do you make this balance? And it's not only about having strict public health measures in place, it's also bringing a balance between health measures and economic viability of the country. We understand more about the disease and how to treat. So I think that's a very important thing. And then over the duration of the pandemic, the disease have really evolved too.
Of course, there's no denying that the health threat remains. Even with less than 30 cases daily and little to no deaths over the past few days, experts agree that COVID-19 should not be overlooked. In fact, Director of the Pan American Health Organization, PAHO, Dr. Carissa Etienne, says it's too soon to lower our guard.
Optimism alone cannot control the virus. It is too soon to lower our guard. Public health measures are being left behind in many parts of our region. Some, but not all countries, are making that decision based on risk assessments and health data.
But Dr. Anthony explains that the virus itself has changed, resulting in less severe symptoms for more people, particularly those fully vaccinated and well boosted. This, he said, could help remove the world from the pandemic.
We have seen that change to where with the most recent variant that has been circulating, Omicron, that instead of having more of the lower respiratory tract type of infection, that you were getting more of an upper respiratory tract infection, which was much milder.
One concern that lingers, though, is children's safety. In Guyana, Pfizer vaccines are available to those aged 12 to 17, but uptake remains low. And for younger children, vaccines are not yet in country. And Dr. Anthony acknowledges these concerns.
I think the danger would be if children pick up the infection, more or less it might be asymptomatic or if mildly symptomatic. They can take that infection home, and older people at home who remain unvaccinated can be at risk or in danger. So that's something that we have to be mindful of. But again, I think it would be safe for children to go back to school once we keep some of the measures in place.
Of course, behind all the facts and figures, there are real human beings who are affected by all that has happened. We have Isanella Patwa, a newsroom journalist who herself had COVID-19 and was pregnant during the COVID-19 pandemic. Isanella, what was that like for you?
I got pregnant in 2020 and I delivered in April 2021. I was very worried because at the time, there were many risks associated with pregnancy and delivering a baby. But most of all, I was afraid because I knew that I would be the only person in the delivery room. And I didn't want that. I wanted my partner to be with me, or my mom or my sister or somebody, but that didn't happen. I was completely alone.
You got COVID-19. You got COVID-19 while taking care of your child. Was that a terrifying experience for you?
It wasn't as terrifying because I think I knew that I had COVID. It's just the test that confirmed it. A few days before I tested positive, I lost my taste and I lost my smell. And even now, I haven't gotten my smell back fully. But it wasn't terrifying because, like I said, I suspected and I kept away from him. And I just waited it out until I actually tested positive for COVID. And then he was sent away along with his father to stay with relatives. But during that time, like you said, I was completely isolated. But, I wasn't in the hospital or anything like that. And I was vaccinated, fully vaccinated. So I felt safe to know that I would have recovered in a quick time, in a short amount of time.
Now it seems as though the COVID-19 pandemic is coming to some end. With restrictions being lifted, it is important to reflect on the experiences that we've had over the past 2 years. Schools and workplaces, for example, shifted online as people contended with so many social distancing, mask wearing, and other safety guidelines to protect and mitigate the spread of the novel coronavirus. As it is now, the advice remains that you stay safe, avoid large crowds, keep sanitizing and wearing your mask. I'm Vishani Raghaver reporting for the newsroom.